Hi, I'm Lisa Ishii. I'm here in Phoenix at the annual meeting of the American Academy of Facial Plastic Surgery. I'm delighted to have with me my good friend, Dr. Sam Lamb. He has a successful large practice in the Plano, Texas area. That's outside of Dallas. Dr. Lamb, you have a special expertise in injectables, among the other things in your practice. So can you tell us a little bit what's trending in injectables right now?
Yeah, I just ran a live injection course last night with several of the faculty, and I was very impressed that where I see the trend today is that people are moving more toward sort of a micro droplet technique and looking at little bit of filling around the whole face rather than just blowing up one particular area where it can be more distorting. And I really think that's one of the biggest trends I've seen, because every single injector last night, the same thing. I showed a video of my technique, and I think that's the hugest thing. So I'm really focused more on the injector than what is being injected.
Okay, so talk to me a little bit about how you feel about fat, how you feel about the hyaluronic acid fillers. What are you doing with PRP in your practice?
Sure, yeah, I think volume is huge. There's only one component of the whole thing, and as surgeons we know that if there's gravity there, we can't disregard that. We can't fill it away everything. But I have moved a lot of my practice from fat to fillers because a lot of people today just don't want to have any surgical treatments. So how I use fat is if someone has enough volume loss, they're metabolically stable, I'll do a fat transfer, or if they're doing a facelift, I do a fat transfer. A lot of people come in, they just start fillers because that's what they want. PRP for me, how I use it in my practice, I know you do a lot of hair as well, it's really for me integral to how I use hair for surgery as well as a standalone procedure, but I don't do it for facial things. I haven't found to be as successful in my hands.
Okay, so your patients are just as comfortable with the fillers as they are with their own fat. You don't find that there's any preference for autologous tissue?
I think today there's just a preference for ease and having a ability to spend a little bit of money, more money, coming back and having little downtime. So there's definitely a trend, as you know, over the last decade moving away from more invasive procedures. And fat, even though it's non-cutting, there's still a decent recovery with it. And so that's why there's a migration now toward minimally invasive procedures. And one more thing, I think that when you look at fillers over the long haul, even hyaluronic acid-based treatments, you're seeing longevity. I'm telling my patients that they're almost permanent because over time they just hold.
That's fantastic. Thank you so much for sharing those pearls with us, Sam.
Thank you, Lisa. Appreciate it.